Thank you for a nice introduction. At the beginning, I would just wish to thank organizers and organizing secretary for inviting me to give a talk on artificial intelligence in clinical skill training and in medical education. My introduction has been given, but my contact pertaining to this lecture and experience comes from as a consultant in persistent systems. In addition, I've been working with distinguished professor as a Symbiosis International University. I'd been fascinated by technology for health, and if you go to my website, arunzamkar.com, which proudly says that the technology for better health care, which says that all healthcare problems of India would be solved only by technology. Now, I am going to put this lecture on arunzamkar.com, and you are advised to have a link, and then I will put this on YouTube on my channel, so that even if I talk less in this meeting, the detailed lecture will be available on the website. At Persistent, we had been working on artificial intelligence. My son works with NVIDIA, where I visited, where there's a huge mural of what I am AI, and I wear that proud T-shirt. Now, AI has been giving more importance as a low-hanging fruit to image handling, and image handling requires what is called as a graphic processor. Instead of a CPU, we want a GPU, and then the GPU, the growth is faster than CPU. AI would work with a lot of other things like IoT, what is called as Internet of Things. And then we have what is called as Internet of Healthy Things, where all IoT devices related to health are there. And then we have a lot many things being happening in wearables. And therefore, these three things are very, collaborative. AI with wearables and IoT would be useful even in skill training. With AI, what is happening is we have what is called as a big data. And this big data is coming in healthcare, and this is coming from, knowledge explosion in the journals, from the EMR data, from patient data. And then this is so large that it is beyond human brain capacity to utilize. At the same time, it would be criminal if you don't use that latest data for management of patient. And therefore, individually, you can't use it, but then through AI, you can use it. AI is when computer making decisions for real world problem. And then John McCarthy defined this as a machine with an intelligent behavior, such as perception, reasoning, learning, and communication, and their ability to perform human tasks. Now, what we think as a theme of this conference is what is called as, we want to have a thinking process which goes towards AI and towards technology. And I think I must appreciate this whole theme. And that's why we want to use a word, artificial wisdom. It's a software system that demonstrates quality of being wise. And artificial wisdom can be described as artificial intelligence reaching to the top level decision making, where confronting a human touch. And I think that whole thing is there. And if we see artificial wisdom, AI would go from a data to information, then to knowledge, and to wisdom. And that wisdom is important, and that's why this wisdom is more important. And that's why we want to use that wisdom for skill training. I just briefly narrate what is AI, what is ML or machine learning, and what is deep learning. So AI is any technique that enables computer to mimic human intelligence using logic, if-then rules, decision trees, and machine learning. Whereas a machine learning is a subset which improves the task with experience. And the machine learning is something which is more and more important for skill training and medical education. For deep learning, we have all those algorithms going inside, and therefore what is called the hidden layers. And for medical education and skill training, we need an artificial intelligence leading to artificial wisdom. And then I won't want to detail, but there are machine learning. We are talking about what is called as unsupervised machine learning and supervised machine learning. And the supervised one is being used commonly for image handling. And then there are various programs available, the clustering, classification, regression. And I think this whole thing is important. And when you go to deep learning, when the application learning, that complex algorithms, and where we use what is called as a deep neural network. They are like a neural network, but then we have input and output, and therefore we have a lot many hidden layers. These layers make it simple, and that's why we use this DL. Now, as I said, image handling is something which has been commonly used, and all images in medicine are being used. And therefore, once we have an image handling, we use usually supervised machine learning, where an image is processed and then features are engineered, and then we do modeling and extract. And once you deploy it, what you call as matches with a new image, and then it gives diagnosis. And AI, I'll just briefly say about what is happening about image handling. AI is being used in skin diseases, where it gives an entirely a new outlook, and maybe it's more reliable because the data of images is far more. And then somebody can use and create an app, so like this first term, where if you have to upload the images of skin disease, it gives diagnosis. And I think such apps would require a big data. And we being in Indian, we have a lot of big data available. This can be used. And then there's something called as diabetic retinopathy. And then we can use this. This is being used for screening. The same thing can be used for screening of diabetic retinopathy. And then radiology, I'm just giving an example of X-ray chest, where all these findings can be detected. And I think overall, it is getting more and more confident. So what is important now is we are doing what is a low-hanging fruit in mammography, where in mammography, the AI system has been found out to be better than radiologist. And so much so that there's a nice paper coming in Nature, where AI imaging of, say, mammography was, you can see the large size, was found to be better than a panel of radiologists. Now, where you can use AI in medical education? Now there is a whole thing is going in medical education as what we can do for curriculum planning. And then what is required is 3 levels of medical education. One, curriculum development, and then curriculum assessment, then learning process, and then as a student, it is very useful. So best thing is happening is AI can be used for academic governance, because with all CBME, that whole thing is coming in such a big way that you require a whole overall digital technology for governance, so that whatever curriculum you want to teach in the parent department, in horizontal integration, vertical integration, and then student dashboard, this whole thing can come with an AI. Then we can do in AI in assessment, because we just are slave of a similar paper being given all over the center. And therefore, what we want to see, that you can create multiple question papers based on difficulty index and differential index. It could be a graded question paper, progressive difficult questions, and you can follow these question papers. And then we can, the moment we have this data, we can have a separate set of question paper, which could be a similar difficulty, and we can use advanced methods of scenario-based and real-time patients. And therefore, the moment I want all of you to work on this, where we can use an AI system for assessment and calculation of creating a database, depending on difficulty index and differential index of past question papers. And then you can create a new question paper. And then we can do maybe a series of say application available where the new paper can be set at a desired level. Now the assessment, if you see, of the reliability of all tools would depend upon how often we are doing and what length of time. That if the testing time is 1 hour, then you can see that there is a whole differentiation. But if the testing time is more than 8 hours, then whole thing can be say almost same thing. So what we can do is we can have a dynamic real-time assessment of student. The student volunteer to get real-time evaluated, then they choose topic, and then we can have resource management where AI system can identify what are the lectures required, what are the books required, and all the resources. And then we can monitor like a Kindle what has been read. And then at a given time, when a student wants to have assessment, we could create a question paper of skill assessment through a data bank, and we can have an assessment again and again. Therefore, this whole thing would give you multiple points and would be an ideal. Then, as I said, you require resource management. So whole list of resources are available. Now, once this system is connected with the EMR, then we can get a patient, say at the moment, suppose carcinoma of breast, the patient will say the student will get SMS from the system, and therefore say what is the operation going on, what is the theater list. This whole thing could be connected with the AI and EMR so that the resources are used maximum. You could have all those inputs, books referred by last batch, books referred by say future batch, and then you can continue update with the machine learning, addition of online sources, and then all these resources could be available, including PowerPoints to the student. And as I said, you could create a paper depending upon the requirement of whenever he wants. Now, as a skill training is concerned, these are the various ways: simulation technology, virtual reality, chatbots, say robotics, and all that. And there is a lot of what you call as overlapping. So what we can do is, let us say, skill training with simulation. I just want to show this video to you where the simulation is being used for a long time by say airline pilots. Now this is a video where in simulation there is an evidence of birds hitting, and now this is the famous say what you call as famous flight where there were birds hitting, and then because this pilot was trained with simulation, he preferred to land in Hudson River rather than going back. And I think this whole experience was because of his experience of a simulation. Now we have several simulators available for laparoscopy, DaVinci, DV, Ross, and then if you can see, these are the laparoscopy stimulators, and you can see what are the various what you call as manipulations available. With the best one is Ross, where there is endorist, camera clutching, fourth arm declaration. All these things are available. Obviously, it is costly, but then I think that is one which can give you complete training of robotic surgery as well as for virtual surgery. And then what we can do now at Persistent, we are planning to develop AI guided. I like to ride my bicycle, ride it everywhere. Hello. And what we plan to do is an AI-guided surgical operation system. Now, the moment you put the trocar inside a laparoscope, say abdomen, the image data will be available which identifies the organ. And then exactly the station and location of the instrument is identified. The system will find out what are the things around, given by an AI data of organ surrounding. And then we can put a guiding where, so let us you want to do a laparoscopic cholecystectomy. So you can give a destination of going towards that way, that particular area, the image. And then the AI will guide you how to go, and then it will have an ultrasonic tip so that it will contain and vessels and structures around, and it will be like a Google map. I think this is being prepared by Persistent now because of non-disclosure. I can't give you detail, but I think that would be one of the nice things to happen. And then we have simulators available for endoscopes. So orthopedics, we have for arthroscopy details, then laparoscopes, we have already seen essential skills. And then we have for urology, where they can teach TURP, TURB, and through a simulator. Then we can have GynAC, where we can do hysteroscopy and all procedures. And I think these whole simulators are giving a nice skill training for arthroscopy, GynAC, laparoscopy, and everything in detail. And it would be very easy. Now, let us say, there's a nice paper available on how simulation technology can give you skill training. So ACGME has given you 6 domains, and so same domains could be used by physician during a round. And then you can have aspects of training, patient care. Let us, you can have cardiology patient simulator. Then we can evaluate medical knowledge using the full body simulator. I think all these domains with the data available could be seen for what you call as skill training. Anyway, once you go into details, there is a nice paper from Cochrane where there is a database where it has seen that in GI endoscopy, although all these simulations are available, they were not much happy because overall use of instrument control, flow procedure, use of assistant, everything is nice, but I think they were as par with an human assistance. And simulators can come with VR, what's called virtual reality. And now these are the simulators with virtual reality, and then expanding precision virtual reality in patient education, where patient can see. And then we can do what is called as an AI system with virtual reality. A support vector machine algorithm was used in data gathered from hemilaminectomy done by VR, by different organs of varying skills. And AI-based VR training has also been used in neurosurgery. The 4 metrics of safety and movement of framework called virtual operative assistance can be created. This provides a metric-wise assessment based on weight of each metric, and this can be applied to evaluate the skill level of training. Another AI-aided VR study was carried on neurosurgical tumor resection, and they were classified into 4 levels. And therefore, AI, say VR-based simulations was found to be very, very useful. And then we can have what is called as machine learning to assess surgical expertise. A machine learning to assess a checklist was designated, and it will include 4 sections: quality of discussion, design of study, structure of data, supervised machine learning, and further. And conclusion of this paper, where AI-based VR system were used, is very useful. And then these are the various AI-based systems available, and then they are found to be reasonably useful. Then we can same thing. Can we use this technology for direct observation of procedural skills, what is called DOPS, and then we can have video analytics for DOPS. Now, there are several papers coming on this, but I think this could be developed. And tennis and cricket player use it for the steady movements, and therefore this DOPS was used for a video analytic, and the study to determine the video modeling of skill acquisition, say hand motion entropy, timing metrics, all of them they were used. And then we can find out that your whole movements, say mean time to do incisions, and this whole thing could be done with a video analytics, and synchronized motion analysis for assessment of procedure in theater could be done, and this was giving you far better results. And I think this is a laparoscopic appendectomy, and where video analytic was giving a checklist to find out how it can be improved. AI system can be used in communication skills, and then there is one program available called Empathic, where it is modeling of professionalism and teaching humanistic communication. And therefore, then this is instead of talking with a patient, you can talk with a human touch or humanized what you call it as a patient. And then there are several things can be studied, like perception, invitation, knowledge, emotion, summary, and then crash and steps. And then this has been used to study a communication skills, and this is how a humanized patient would be seen. And then the paper says that on the OSCE, where the students were trained by say videos and human presentation, and then they were better with a what you call it as empathy. Now, clinical diagnostic skills can be studied. Now, we have developed a scheme called as eye doctor, where it is an drug dispensing ATM, which is based on symptom-based algorithm. And therefore, we created a kiosk with an AI system clinical diagnosis. And therefore, all these differential diagnoses could be done. And this could be put in, and this, let us say it's abdominal pain. So what are the various things to be asked? And this whole thing was leading to a diagnosis, but then same thing can be used because it's an AI-based flow chart to have a differential diagnosis. And then it can be used for teaching history taking as well as evaluating history taking. And we have US FDA approved recent algorithm-based diagnostics approved in so many areas. Then through robots, we can do, and then in robotics, with the advance of robotics, it's possible to get data from many forms, and this could be used for AI-based skill education, kinematic data using global movements, and whole thing can be done. And then what is important is all these things are coming with what is called the haptic feedback. So haptics is touch feedback, which may include kinesthetic and cutaneous feedback. And this could be used for a modality of touch and surgical training. And therefore, with the robotics and haptic feedback, with the VR, it could be given you better training. So in conclusion, artificial intelligence has been used and being used for all domains of skill education with simulation technology, robotic technology, virtual reality, and then it's, I think, the future of skill training in medical education. Similarly, we can use it in communication skills, we can use in clinical diagnostic skills, and everywhere I think the sky is limit. Thank you.